adapting, and we're I think have a really bright future ahead of us, and it's exciting, and it's neat to see that this can be done. And I'm sure the next 40 years, 80 years will be probably pretty impressive.
Yeah, it's so difficult to know. I mean, what we know is the needs for healthcare are not going away. The way they're provided changes over time, especially as more and more sophistication comes.
Primary care is just as important as it ever was. The challenges will be there as technology improves. Our role continues to be to try to identify the more serious things that require specialty care and manage what we can for the vast majority of people and focus on preventive care.
My hope is we continue to do a lot of what we do well already. I hope what we can do better, in particular, we can be part of the solution to providing better dental care to many of our patients, and that is certainly an area we've identified as a massive need. We want to be part of the solution in providing better mental health care for a lot of our patients, and I hope will be a success over the next 40 years as well.
As long as there are people living in the Adirondacks and surrounding communities, there's going to be healthcare needs. Those needs are going to evolve, and the use of technology is probably going to impact that pretty profoundly, but at its core, it's about the relationships that we have with patients. And so we need to grow in ways that embrace the advantages of technology, but also keep care personalized and relationship-based.
Learning what you can do via telemedicine without losing the personal touch. Learning how you can deliver care more efficiently. I think this is all going to be a major positive change for the United States healthcare system.
Things have changed so dramatically that all we can know is we got to be prepared for more change. And as much as the caregiving changes, the need for the care and the patients we serve are not.
What I'm most excited about is to see what this group of leaders can do with this incredible base that we've been provided, and along the way, really strengthen and solidify the communities that we live in and that we really love and appreciate.
And I hope that we continue to evolve a model that's truly sustainable, so that we have a pipeline of really well-trained providers, well-trained nurses to come in and keep this going.
Every aspect of the community revolves around good health care. Today, as we look forward to mobile health and other opportunities in new regions, all the way up to the Canadian border. So it's not about creating the dollars to build a new building. It's about working with the organizations in our community that will improve the mental or physical health of the residents.
It was nothing that we could have possibly imagined when we started, and it's still to this day, when we look back, it just takes our breath away to see how much it has evolved.
40 more, and then some. It was a great idea. It's even greater now.
Just hope every day to do the best that we can to really continue what has now become a really large network with a lot of patients, staff, and communities that rely on us. If you think about the broader reach of the network, we have a pretty big responsibility, and that we take really seriously, and I think that's where the future is.